Welcome everybody, and today we are in the ABM dental office located in the heart of Mississauga, talking with Dr. Beata Sowiński about dental occlusion and digital occlusion analysis. Dr. Beata, what is an occlusion?
Hello everyone. Occlusion can be described in the narrower sense when when we're thinking about how the teeth are aligning with each other, and also it can be in the wider perspective when we are talking about the whole masticatory system, joints, jaws, tendons, skeletal components like cranium, muscles. So the components are actually like intertwining with each other. When we're thinking about occlusion, the occlusion is not recognized as much as it should be. We are thinking about the terms like malocclusion, or in lay terms bad bite, and sometimes people can recognize that they have malocclusion. When they look in the mirror, they see that they have cross bite, that they have open bite, and they recognize that something is wrong with the bite. But a lot of times the occlusal problems are stealthily destroying the dentition, and unfortunately the awareness of the patient is not as much as with like big problems, but the problems which are accumulating in the time, they are destroying teeth. Patient might notice at the end that something is wrong with the gums, might refer to the pain. So occlusion is very important. But occlusal problems, malocclusions, are misdiagnosed or not diagnosed enough. So I think that this is very, in the spectrum of dentistry, this is a big problem which is not diagnosed properly.
So what are the occlusal disease symptoms?
Occlusal disease symptoms are different. They can start with the teeth, so teeth can crack. They can be very painful on biting. They also, when they are misaligned, patient notices that there are meniscus, there are parts of the enamel which is wearing off. But the problem is that the process is very long. It's in long span of time. So when the patient notices finally that something is wrong, sometimes the part of the whole half of the tooth is gone. So a lot of times people are noticing that they have reverse smile because incisors from the front teeth are gone.
What are occlusal disease symptoms then?
Patient may notice that the teeth are shorn off. They lose the horizontal and vertical dimensions. Teeth can be painful, can crack, or can be painful biting. But also, patient, because the malocclusion has influence on many different parts of the stomatognatic system. So the joints can have cracking or popping sound, and they can be also accompanied by pain. Patient may also notice that the gums are receding, that there is some mobility in the teeth. So there is a different symptoms, and patients are coming with this different symptoms to be analyzed by the teeth scan.
How do the dentists measure the occlusion?
Most dentists measure the occlusion by the analog means. So they're using the shim stock or blue paper, and those methods are very good, but they are old-fashioned. They are very subjective to the what operators' skills are. But T-scan is much more objective. It is one of the best methods in the clinical world right now regarding the occlusal measurements. So the T-scan looks like this. We collected the data on the handle, and the data was transferred to the computer. So this is how the teeth are touching. This is the upper jaw and this is the lower jaw, and you can see the percentage left side to the right side, what are the distribution of the forces. So it's very, very visual, very easy to interpret, very easy to diagnose. I really like this because this is very easy for me to show the patient what's happening with the teeth. So this patient was actually almost ideal because we are aiming for the bull's eye here to have a balance. If we have it closer to this point, it means that it's more balanced. Let's look at the second sample patient. So this patient has problems. I will stop it for a second and I will talk about it. Those are teeth which are not in balance. You can see those islands of a different color here, and you have scale here, so you can see that this is low contact and high contact. So we usually, when we're looking at the scan, we know that there are some problems here, and actually when you see, there is actually showing which cusp is involved. So I can actually show patient, and patient can interpret by itself, by himself, what's happening in the mouth, because usually sometimes patients are aware that something is wrong, but they know that it's in the back of the mouth, but they don't understand which tooth. So when I point this to them, they say, this is the last tooth. Yeah, you're right, this is the first contact. And you can also see that we don't have bullseye here. This person is not balanced. It has 60% of balance on left side and only 39% on this side. So it's from the balance is thrown off. So when we start again, we can see, because this is the time when the bite was, that we have to adjust those teeth to make the bite perfect. It's very easy, as I said, you just insert this in the mouth and the data is collected. So it's a simple but genial device to have occlusion checked.
So what do these colors mean?
The colors, the gradation of the color is from the lowest, so those are normal contacts, and the gradation goes to the red, and red are like red flags. So we know that if there is a red on the area of the tooth, we have to adjust it.
Does the red mean the forces
are too high? They are too high, and also what it's fantastic, when patient has implants, we have those implants with a stop sign. So if the implant is impacted, and even minuscule the touch can throw the implant, because we swallow 2,000 times per day. So if implant is gently but kicked 2,000 times, after a while, it can, the tissues can bruise, and actually implant can become mobile and will fail. So this is very important, and this is I think that is fantastic, because whenever we have bridges, because of course all patients, all teeth are assigned here. We know where are the crowns, we know where are the bridges, we know where are implants located in.
And you have instant feedback, because you can check each
and also
every time.
this is someone came up with the idea that it has stop sign. So immediately when the implant is involved in higher occlusal forces, it stops and they say, hello, you have to do something with it, because I'm getting hit by the occlusal forces. So it's very fun actually to work with it. It's very nice diagnostic tool. So T-scan measures the force between the teeth and timing of the contacts occurring between teeth. The data collected is easily interpreted because interface is very clear. It's very easy to read, even for the patient. It's very visual, so all the forces can be judged objectively. We can accomplish this result, which are not achievable in any other method. It elevates diagnosis to completely different level of sophistication. The objective data allows the clinician to provide the very precise treatment, enables to get more precise results.
So this is the technology which helps in identifying bite issues that can lead to problems such as jaw pain, broken teeth, and even headaches?
Yes, correct. By providing precise digital analysis, it allows dentists to collect more information and make more informed decisions about adjustments and about treatments needed for balanced and healthy bite. Our clinic is proud to be one of only 3 clinics in whole Ontario which has this technology. So we are ensuring that we provide for the patients top-tier care with the latest advancement in the dental diagnostics.
What are the top 3 benefits of the T-scan technology in dental care?
Occlusal imbalances can be found by the T-scan. T-scan accurately identifies occlusal imbalances such premature contacts or even bite forces. So it can, both high bite forces can lead to the discomfort, to pain, and dental problems which are not treated properly. Next one is treatment precision. We know exactly what to do and when to do it and how to do it, because it enables dentists to precisely diagnose and treat occlusal issues, and we have like more targeted treatment. The third one is enhancement of function and comfort, because this can helps to optimize bite function and alignment, reducing risk of complications and improving overall comfort and function for patients, leading to better quality of life.
Why dental occlusion is such a wide problem?
The dental occlusion is a wide problem in context of dentistry, because the occlusion means the contact between the teeth. It relates to the relationship between maxillary upper teeth and mandibular lower teeth, but also we have to think about the periodontium, we have to think about the skeletal components, neuromusculature. So the tooth contact should not be looked at as in isolation, but in relation with all the overall masticatory system. Because the occlusion influences so many structures of the stomatognatic system, it's very important to have balanced and adjusted occlusion.
So is this T-scan test painful or invasive in any way?
No, it's a good question. It's not invasive. It doesn't require any anesthetic. It's not painful. This is a paddle of a T-scan, and the T-scan is very thin. It has 100 microns thickness, so it's very thick. It's very pleasant actually to put it in the mouth and measure, and a patient tolerates the scan very easily. And we usually scan lasts about 1 hour. Sometimes it depends on complexity of the problem. Sometimes it requires couple visits, but it's all depending on what was treated.
So tell us about the real-life situation where a T-scan analysis can help.
And T-scan is very helpful in analyzing different problems. For example, if patient has new dentures and the denture teeth are creaking and they are not in balance, so like the denture pops and creaks and rocks. So this rocking is not very pleasant for the patient. So we are doing the scan to see which teeth are like kind of throwing the denture off the mouth, and when we adjust it, it's much more comfortable for the patient. The next one, we notice that more and more patients are deciding right now to be treated by the implants, inserting the implants. And of course, we know that the most important part of stability of the implant is meticulous hygiene of the oral cavity. But on top of this, the implants are static. They are in static relation between the bone and themselves. So unlike the regular teeth, our natural dentition has more giveaway, because it has mobility, because it's on the ligaments, tiny fibers which are between the bone and the tooth. So they can accept some forces. Implant doesn't. So any excessive force can actually cause the implant to fail, and many implants failed because of stronger forces which were applied to it.
So in what way T-scan can help with joints pain or headaches?
The T-scan, the temporomandibular joint is actually very specific because it's only dual joint in our body. Their actions are expressed simultaneously. So whatever is like any malocluded teeth can throw out this balance of causing stretching of the muscles and tendons and triggering the stress points. So headaches and muscle pain and even joint pain or joint remodeling, so the bone is remodeling because of the occlusal stresses, can be caused by misaligned teeth.
To summarize, anyone who has problems with occlusion should have T-scan testing.
Yes, and you don't want to, you don't have to move to our practice. You just can come for the visit just to see if the implant is secure. But also it pertains to any other restorations like zirconia crowns, bridges, veneers. If someone wants to check the occlusion to protect the dentition, new teeth, new implants, they can come to our office. We are located in heart of Mississauga, 100 meters from the St. Maximilian Kolbe Church. Our address is 4240 Wilcox Road and our phone is 905-272-9966. I hope that it will be helpful for any patient to have a T-scan done.
Thank you very much.
Thank you so much.